Thank you for that wonderful introduction, Megan. Like you already mentioned, we're going to talk about how to maintain your brain and cognitive health in the new year and how to stick to brain boosting solutions. So Megan already kind of mentioned it, but we'll start today by discussing what helps us maintain our cognitive health. This might not be new to people, and at the same time, it might be a nice reminder to really kind of get a booster session on those kinds of things. Then we'll be talking about how to set effective brain boosting goals and how to get started with them and to stick to them. So we'll dive in with that very first topic that I just mentioned, which is what helps us maintain our cognitive health. And there are a lot of different areas that we can think of in the maintenance of our cognitive health. There are a lot of different neuroprotective factors for healthy aging, and all of these also really help when you have already, gotten some symptoms of cognitive difficulties or when you have been diagnosed with MCI. So we're going to talk about all these different areas briefly today. The very first area that I'm going to be talking about is whether cognitive activity matters in late life. And it absolutely does. So there have been a lot of different research studies on this topic, and a lot of this research has resulted in what we call the cognitive reserve hypothesis. So what this theory or concept really means is that it says that those who have had more enriching experiences, whether it is learning another language, knowing 2 languages, or being really well educated, having done some sort of degree, or staying mentally engaged in your job throughout your life, all of that falls under what we call cognitive reserve. And Dr. Jakob Stern at Columbia has done a ton of research studies, and since then, many other researchers that show that if you have more cognitive reserve, or if you've had more of those enriching experiences, you're more likely to have better cognitive performance, even if you have, for example, signs of Alzheimer's disease present in your brain. And so having these enriching experiences can really help us be protected to any kind of brain pathology. And so you might think, okay, well, I may or may not have learned another language earlier in my life. Is it too late for me now? And actually, studies show that that is not true. So even if you are more actively engaged in activities now, that has still been shown to be really protective. So there's this one other study that's really great that showed that even late life cognitive stimulation is really important. So in this study, they looked at cognitively healthy participants, and they had them rate what kind of activities they were engaged in. So they asked people, do you tend to be primarily involved in watching television, listening to the radio, reading newspapers, playing games or crossword puzzles or those sorts of things, and going to museums. And what this study found is that those who were more engaged in cognitively stimulating activities, so for example, playing games or crossword puzzles, those actually remained cognitively healthy for longer, again, even when there were some kinds of pathology present. So they also found that to be true in the people that had been diagnosed with mild cognitive impairment. So that's great news. So what does that mean for you? That really just means that even if you try to become more cognitively active at this point in your life, that can be really beneficial for you. And so a little bit more on how to get started on that. What we know works best is if you engage in activities that you enjoy. So activities should really be challenging and should be fun. So just a few ideas of what you might do is, learning a new skill, learning to play the guitar, taking a cooking or an art or a computer class, learning how your camera on your phone works, or how you make really excellent photos with the camera on your phone, forming or joining a book club, or learning a new language. All of that can still be really beneficial for your brain. So just a few things to think about. Now let me advance to my next slide, and some additional tips on this. It's also really beneficial to do these kinds of activities with someone else. So let's say you're trying to learn a new language. Maybe you do that together with a good friend. You can also choose activities that involve both mental and physical engagement. And we'll talk a little bit more about examples of that in a minute. And another big tip that I have is to think about activities that you were involved in earlier on in your life that you enjoyed, that are cognitively stimulating, because what we tend to see is that it's a little bit easier to pick up prior activities that you enjoy than to start with completely new ones. Although if you would like to start with something that you've never tried before, definitely go for that too. That's also an excellent way. So whatever really works best for you. Another area that I want to talk about that we know helps bolster brain health is, being engaged in social activities. What we know is that social activities are also very beneficial. What we know is that social engagement is related to greater brain volume and functional connectivity in brain regions, including brain regions that are important for memory. And because of that, it can also help prevent the onset of cognitive difficulties, and it can prevent the onset of neurodegenerative conditions and also things like depression. So lots of reasons to become more socially engaged. And again, just a few ways, a few ideas on how to start with this. We really recommend that you get out and about. And here, there are so many ways to do this. But a few ideas include playing cards with friends, going to the theater, watching movies, watching musicals, whatever it is, going to sporting events, going on trips, trying different restaurants, try a new one that you haven't tried before, joining a senior center and engaging in those kinds of activities, joining a group that does a specific kind of hobby, like a knitting group or a hiking group or a painting group, or getting more involved in your community. So serving meals for example, homeless people, caring for dogs and cats in an animal shelter, volunteering in different ways, or even getting a part-time job. There are so many ways to, stay socially engaged. And as you can see, a lot of these will also help with staying cognitively engaged. So they really help in several different ways. Another really important area of brain health is exercise. I actually did another community CEP Community Live event just a couple of months ago where I talked more about this. And the reason that we just keep hammering on this is that it's just so beneficial for brain health. So does exercise help? Absolutely. So what we know is that it's linked to neuroplasticity. It's a protective factor for neurodegeneration, including in MCI and Alzheimer's disease. And it's just generally has positive effects on cognition. There are many other benefits that I went through in more detail in my last talk, but it also helps us remain, well coordinated, helps with agility, it helps reduce fall risk, it improves our bone health, and it reduces the risk of serious outcomes from infectious diseases like COVID and the flu. And it lowers the risk for several types of cancer, and it really improves our mood and well-being and improves our sleep too. So this is another really important area. There is always the big disclaimer that we would not like you to start running marathons without checking with your doctor first. So just run by your doctor whether the exercise plan that you have in mind is a good one for you before you really start making really drastic changes. But what we know is that some level of exercise is good for everyone. So the CDC guidelines for physical activity include, being active every day, completing activities that improve your strength and your balance for about 2 days a week, doing about 150 minutes or more of moderate exercise, or 75 minutes or more of vigorous exercise per week. And so how you split that up is really up to you, but trying to stick to those, recommendations can be beneficial. And what we also know is that, sitting is not really good for our body or our brain health. So reducing, for how long you sit. So making sure that every hour you get up and walk around for a little bit. And similarly, try to break up periods of not moving at all. Another area that I think you're very familiar with at this point, especially if you've been coming to these presentations for a while, is nutrition. So today I'm not going to go into depth here, but what we know is that nutrition does really matter for our cognitive and brain health. So really briefly, a few of the diets that are recommended for brain health are the DASH diet. And really what that means is that's a diet that's rich in fruits and vegetables and whole grains, and it's low fat and dairy foods. And it also includes, things like poultry, nuts, and beans and fish. All of those things have been shown to be beneficial for your brain health and therefore cognitive health. And this diet also includes, limiting things like sugar, sweetened foods and beverages, red meat, and added fats. So I'm sure that's not very unfamiliar to people, but I still wanted to briefly touch upon that because it is important for our cognitive health. And similarly, making sure that your medical and vascular risk factors are well controlled is also really important. So if you haven't gone to the doctor for a while, make sure that you make an appointment with your primary care physician, because what we know is that things like hypertension, if that is well controlled, that's really beneficial for our brain health. And if we're very variable in, for example, hypertension, in the long run, that can really start to impact our brain and therefore our cognitive health. So making sure that these factors, things like hypertension, hyperlipidemia, diabetes, cardiac disease, and sleep apnea, we can be diagnosed with these, but then making sure that they're as well managed as possible really will, in the long run, help boost your brain health as much as possible. Let's see, another really important factor, and one that I tend to work with a lot, is making sure that you boost your mood and lower your stress as much as possible. What we know is that mood and stress do matter for our cognitive health. So what we know is that stress can interfere with things like our attention, our memory functioning, and our overall thinking skills. And that prolonged stress, so the important word there is prolonged stress, we know that that is a risk factor for dementia and is associated with, a conversion from MCI to dementia. What we also know is that, stress is part of life. It's a normal response to the demands of life. And we can never live a life that is fully without stress. But at the same time, making sure that you're not stressed for a really long period of time is going to be the most important piece here. So it's not that we can't have any stress at all. It's really that nonstop stress is really exhausting to our body and to our brain. Let's see. So what can we do to help manage our stress? Well, I'm sure that most people have experienced stress in their lives before and that they've already tried some things and some things might work for them. A few things that you could think about are, for example, doing the things that you enjoy. especially when you feel like you have, been a little more down or just experienced more stress recently. It can be really beneficial to pick up some of those activities that, even if you're not in the mood for it, what we know is that it does tend to help boost your mood. So even if you don't want to do it ahead of time, you might find that if you try it out, you'll start to feel a whole lot better. Being physically active, so I talked about exercise before, also really helps in boosting mood and managing stress, or managing the impact of stress on our bodies and reducing stress long term. Getting enough sleep also really helps boost our mood, and I'm going to talk about that in a moment. And then asking for help or support of others is just a really great strategy, excuse me, to reduce stress and to get some help with those stressful activities that you might be experiencing. Excuse me, let me take another sip of water here. And then I have listed using humor here. What we know is that sometimes, when you're experiencing something stressful, it can be helpful to make a joke or to see how comical something can be. That said, it doesn't work always, right? It depends on the specific situation, and trying to laugh everything away definitely won't always work. So that one has a big disclaimer. Communication can be really beneficial also in making sure that those around you, excuse me, know how you feel and know what your needs are. So communication is something that we really highly recommend when you're experiencing more stress. And then also practicing problem solving. So that can be either alone or with those around you. And then a few other things to think about include doing deep breathing exercises and things like mindfulness exercises. And those you can just Google, for example, use YouTube. There are lots of those exercises online, and all of them can be beneficial. What we also know is that it's really a skill that you can practice. So if you're not really, if you feel like it might not work for you yet, or you find that your mind wanders when you're trying these kinds of exercises, just sticking to it and trying it again a few more times, and being, forgiving towards yourself if it's tough, might benefit you, because sometimes they help you more when you've tried it several times. So those are all some things that you might try to boost your mood and manage your stress. Another area to think about is your sleep. Sleep is very important for our cognitive health and brain health. If your sleep is great, that's excellent. If you find that you're waking up a lot at night and then you have trouble falling back asleep, or when you're going to bed, you have trouble falling asleep, here are some recommendations for you. So these include sleep hygiene recommendations. So that includes, avoiding caffeine after noon, avoiding exercise within 2 hours of bedtime. We know that exercise is really beneficial for our sleep, but when you do it too close to your bedtime, it can really, activate your body, activate your mind, and it can be more difficult to fall asleep. What we know is that nicotine is also really activating to our body, so trying not to use any kinds of nicotine products. So don't smoke within 2 hours of bedtime. Alcohol is a tricky one. People tend to think that it really helps them fall asleep, and sometimes it does. And also what we know is that alcohol is associated with a lower quality of sleep, and it might be more likely that you wake up at night and have more trouble falling back asleep. So we recommend avoiding alcohol within 2 hours of bedtime, avoiding heavy meals within 2 hours of bedtime, and avoiding screen time within 1 hour of bedtime. Screen time really keeps our mind engaged, and it doesn't really help us process, our day before going to sleep. What we also know is that blue lights really help activate us, and especially, late at night. That's not really what we are hoping for. So avoiding that blue light by not using any screens can really benefit you. And then I have a few tips for you for if you can't sleep. So let's say you've woken up and you can't fall back asleep, or you just have trouble falling asleep in the first place. What we generally recommend is to do really boring activities. We don't want to get you stimulated or activated. So here are some things that you might try. Reading a book, but don't read one that's too activating or fun. Read a boring book. Fold your laundry, groom your pet, listen to slow and relaxing music, organize, any collections that you might have or photos. Do some really gentle stretching. Again, don't go into exercise, don't go into a whole yoga routine, but some gentle stretches might work. Write in a journal, give yourself a manicure or a pedicure. Again, the more boring, the better. Don't do anything that gets you too active or involved. And then also making sure that you focus your attention on something calming. So that can be those mindfulness exercises that I brought up before, or breathing exercises, or listening to calm music. So changing gears here, I'd like to talk with you all about how to set effective goals. And I think there's a lot to think about as you set effective goals. So reflecting on how you have been doing can be a really beneficial way to start. So in order to do that, it can be good to set aside some time and to find a space that's comfortable for you and where you can focus. And then think about how you've been doing. So for example, in which of these lifestyle factors have you been doing well? And in which ones do you see room for improvement? And then maybe even go another step and think about where do you feel like that room for improvement is the most urgent? Where should you really start out of all of those things? So thinking about this upcoming year, you can ask yourself, what do you want to pay attention to in this next year? What plans or intentions do you have for yourself? And where would you like to be at the end of next year? One thing that I'd like you all to really pay attention to is that your goals are, they'll feel the most effective if they're also realistic. So if you set a goal for yourself that is really broad or that is too ambitious, that can become really discouraging over time. And so a framework that some of you might be familiar with is the SMART goal framework. And that is that goals should be specific. So making sure that they are specific and narrow, which really helps with more effective planning. One example of that is, sometimes when you ask people to set a goal, they say, next year I want to be happier. And that is really hard to put into more specific actions. So then I ask people, okay, what would that look like for you? And sometimes they'll say, I want to go to more events that matter to me. Like I want to watch my grandson's soccer games more frequently. And that's a whole lot more specific. And by the end of that, you can actually see whether you have, reached that goal. So that brings me to the second letter here, which is that it should be measurable. So again, when you think about what being, what those activities that you value look like, you can think about, how frequently did I engage in those activities? And that's something you can measure. The A in the SMART goal stands for attainable. So making sure that you can reasonably accomplish this goal within a certain time frame, whether it's in a month or in the end of the year. Either way, just make sure that it's not too ambitious, like I mentioned before, because that can be really discouraging. And then the R stands for relevance. So your goal should align with your values and your long-term objectives, and they should be time-based. So like I said before, they should be attainable within a specific period of time. So that all might give you something to think about as you set your goal. So when you think about all these different areas of brain health, think about, what you would want to do with that specifically. So maybe I want to start exercising at least twice a week by, this and this month. Or maybe I want to start, going to a social activity at least once a month. Whatever it is, it can be in all of those different areas. Just think about that it should be specific, measurable, and that you and attainable. All right. So how to actually get started with these and how to stick to them, because it's January and we tend to be really ambitious and motivated in January, but as time goes on, sometimes we aren't able to really stick to them. So a few considerations here for you is that I recommend that you avoid an all or nothing approach. So sometimes I'll talk with people and they say, I had this, I was following this diet and was doing really well. And then I ate something that wasn't in line with the diet. So this day is already ruined. So now I'm just going to eat everything that's not in line with that diet because I've already messed up. That's understandable. And also what we know is that small changes make a really big difference. And even if you haven't followed your goals 100%, you may have still made great progress. And so I encourage you to really think about the small changes and being proud of those. We're going to talk more about being proud in a little bit because that can make a big difference. But just try to appreciate the small changes that you're making. And then I've mentioned this piece before too, but it's important to find the things that work for you. So find the activities that you enjoy, that you find important. Brain health is really not a one size fits all type of goal. And so it's really important that you think about what you specifically would want to focus on. As we set goals and as we start working with them, it's important to really start small. So even if you have a bigger goal that's in line with those SMART goals that I mentioned earlier, so let's say by the end of the year, I want to be exercising at least 3 times per week for half an hour. Great. Now think about how to start with that, what that might look like in the next month. And maybe in the next month, what that looks like is just going for a walk down the street and back, for just a few minutes, just to get out of the house and start getting into that routine. And it seems small, but that's actually a very great start. So making sure that you're starting with what's really realistic and what's not overly difficult. I've mentioned this before, but it's just so important that I'm going to mention it again. So choose activities that you enjoy, whether it's dancing, whether it's a hobby you've had before. Do something you like, because that's really going to help you stick to it. And I think I've mentioned this before, but for me, for example, that includes doing exercise with a group, because if it's just me by myself, I just get a little bored and I won't stick to it that way. And I know that about myself, and that's how I, plan my own activities. Similarly, if I were to be choosing activities that I would get, other kinds of, mentally stimulating activities, I really enjoy board games. And so I feel like that would be a really great way for me to stay mentally active. So you know yourself the best of anyone in this world. Pick what you like the best. And do it with other people, especially if you're a social butterfly or if you find that you do best when someone is holding you accountable. Find an activity buddy. And this can be true for many of the different areas that we talked about. Definitely for exercise, mental activity. It can be really, really beneficial to do it together. I've talked about being really specific with the frequency, for example, and the timing of your goals. And what can be beneficial too is to actually put it on the calendar and to create a routine in the things that you do. So let's say you're trying to learn a new language, right? To boost your cognitive activity, you decide to start learning Spanish. What can be really beneficial is that you do a few of the, let's say Spanish classes or Spanish app games every morning. As soon as you wake up and you've had your cup of coffee, you just sit down at a specific spot in your home and you do that kind of activity. What we know is that when we establish a schedule that's consistent, we form a habit, and the consistency or the habit forming itself helps us stick to it. So really focusing on building that habit in the beginning can be beneficial. Another important piece, and this is one of the last pieces that I'll speak to about goal setting and sticking to your goals, is being mindful of your inner critic. So what I hear frequently when I set goals with the people I work with is that, they say things like, I should have started with this kind of activity, with exercise, a long time ago. And so this should have been really easy for me. Whenever I hear things like I should have, I tend to point that out to people, because what we know is that, even if that's true, that's not where we are, and it doesn't help us to think that way. So trying to be mindful of when you're hearing that voice in your head, which can include, I should have been doing it this way, or I should have been doing it all along, to continue to listen for that, and then, tell that inner critic, okay, but I'm doing it now. I'm starting now. And that's still something to be really, really proud of. And that really brings me to the next and last slide that I have, is to celebrate your victories and to feel proud of the things that you're starting. So let's say you have the goal to start exercising, like I mentioned before. What I recommend is that even when you engage in that first walk around the block that you didn't always do before, right? Let's say you didn't always do that. And this week, for the very first time, you managed to get out there, even if the weather may not have been perfect, or even if it is, even if it was. I recommend that you celebrate that you allow yourself to feel proud of that, and that you tell others, I've done this for myself, for my brain health. Whenever we allow ourselves to feel proud, we tend to, get all sorts of positive energy from that, and that can help us maintain and stick to those kinds of habits too. It will make it more likely that we'll get out there again. And in the long term, it's the consistency that helps us do it, and it's the how frequently we're doing these kinds of things that helps us boost our brain and cognitive health. So that brings me to my very last slide. I'm just going to open it up for questions. So